Hi and welcome. Today's presentation will be presented by myself, Sabrina Lugo, Yanely Ortega, Jose Palacios, and Mireya Lopez. The company we decided to complete our performance improvement analysis on was United Health Group. We hope you enjoy our presentation on part 3 of our performance improvement analysis, where we will be discussing the outcome of our analysis. Before we jump into discussing the performance improvement opportunities, I would like to provide a quick overview about United Health Group. United Health Group is one of the largest healthcare companies by revenue and one of the largest companies by net premiums. Its organizational structure consists of 2 branches. The first branch being Optum, which is United Health's technology-focused arm, and runs Optum Health, which is the staffed physical care delivery organization that expands throughout the United States. The second branch is UnitedHealthCare, which consists of 4 divisions that provide various health insurance plans domestically as well as globally. United Health Group's mission is to help people live their healthiest lives possible and make the healthcare system as best as it can for everyone. United Health Group does this by seeking to enhance the performance of health systems and improve overall health and well-being of the people they serve and their communities, working with healthcare professionals and other key partners to expand access to quality healthcare so people get the care that they need at an affordable price, by supporting patient-physician relationship, and by empowering people with the information, guidance, and tools they need to make personal health choices and decisions. The first performance improvement opportunity we discovered was that United Health Group must diversify their business revenue streams to be more resistant to adverse economic conditions. Currently, they rely heavily on insurance premiums, which is about 80% of the company's revenue. Unemployment rates increased during the pandemic, contributing to a substantial decrease of 42,000 individuals dropping United Healthcare coverage domestically. This is equivalent to about twice the seating capacity of Madison Square Garden Arena in New York City. And as you can see, that's a lot of seats. Diversifying their economic portfolio will decrease the chances of losing revenue when unemployment rates fluctuate during public health crises. Strategies to diversify United Health Group's economic profile includes expanding data and analytics, expanding care delivery, and broadening digital services. Currently, through data collection, United Health Group helps many organizations improve performance, achieve efficiency, reduce costs, advance quality, and modernize their core operating systems to meet the changing needs of the healthcare industry. The expansion of data and analytics will widen the utilization of information and diversify revenue away from insurance premiums. It will allow physicians to further identify how comprehensive their care has been and proactively address any gaps. It will further help reduce overall utilization of care and integrate United Health Group's actuarial calculations for their insurance plans. This will help to develop a more accurate price for their plans. Through further acquisition of a wider range of care delivery providers, such as home health care, United Health Group will have greater opportunities to align incentives to better enable risk-based payment, enhance care coordination, improve members' outcomes, and reduce medical spendings. This will further aid United Health Group in developing methods to control costs as medical spendings continue to increase. Lastly, by building out or acquiring digital platforms to better serve their members, United Health Group can further diversify their economic profile. Digital offerings can range from remote patient monitoring capabilities to telehealth services. The Association of American Medical Colleges projects the United States will see a shortage of primary care physicians in the next 12 years. Additionally, the United States is expecting a 10% population growth rate, with the number of people over 65 increasing by 45%. Remote patient monitoring and telehealth services provides a modern way to solve some challenges United Health faces on how to improve member care and manage rising healthcare costs. Remote monitoring services and other telehealth technologies provide tools that enable payers like United Health Group to enhance the quality and access to care while minimizing costs simultaneously. These digital offerings not only facilitate sharing information with members, but makes it easier for payers to provide preventative care and ongoing care for chronic conditions, which helps improve health, reduce further health problems, and in the long run, cut costs to reduce medical costs, avoidable hospitalizations, and hospital readmissions. The second performance improvement opportunity we discovered was that United Health Group will benefit from proactively implementing preventative measures that could reduce economic damage caused by increased medical costs due to natural disasters, such as the COVID-19 pandemic. The pandemic was unforeseen and brought a lot of uncertainty as well as financial difficulties for many businesses and consumers. Medical costs increased due to an increase in number of patients served. This led to a disruption in the stability of United Health Group to identify appropriate reserve levels and had challenges in anticipating incoming premiums with reasonable accuracy. To help minimize the increase in medical expenses for patients and potential loss of members dropping coverage, United Health Group can find ways to prepare for global crises such as endemics and pandemics. Strategies to implement preventative measures to reduce economic damage due to natural disasters include expansion in the collaboration of partnerships with other sectors, establishing a patient web portal, and adopting value-based insurance design principles. Expansion in the collaboration of partnerships within other sectors, such as public health and community-based organizations, can help to support and communicate key changes. And it can help patients, the public, and employers navigate rapidly shifting delivery environments during a pandemic. Collaboration and partnerships can further support in delivering pandemic-specific services, such as testing, treatment, and vaccinations. They can also further identify social services in the members' local areas, increasing member services and satisfaction. Also addressing any barriers to care. Establishing a patient web portal to compile real-time information can further increase member satisfaction and retention, along with keeping members engaged and aware of United Health Group's coverage options. Adopting value-based insurance design principles that deter the use of low-value care and reduce barriers to necessary care will further help United Health Group prioritize lower copays for high-value pandemic services like infectious disease testing during a pandemic, and incentivize providers so that they provide high-value care and eliminate wasteful services. One example to better understand this design is to think of a patient who needs physical therapy. If seeing a physical therapist via telehealth over an orthopedist in an office offers a safe, higher value pathway, then benefit design should reflect the higher value through lower copays.
To recap, the two performance improvement opportunities we discovered for the company include diversifying business revenue streams to become more resistant to different economic situations, and to proactively implement preventative measures to reduce economic damage. The goal of both performance opportunities is to help the company become more resistant to economic hardships such as epidemics and pandemics and continue to serve the public. Tools and methods that can be used to implement performance improvement opportunities include process, outcome, patient experience, and structure. These are types of measures United Health can use to begin the process of implementing our suggested performance improvement opportunities. Measures of structure focus on evaluating the resources available to support the company and its ability to deliver health insurance and healthcare. These are some of the questions that can be asked to obtain information on the current structure of the company and ways on how to improve it. Is United Health able to economically support employees? In times of public health crisis, can the company hold on to its staff with their current income revenues? Is Optum Health understaffed? And can they still maintain patient flow during economic crisis? Does Optum Health know how to continue to keep patient flow when in-person resources are not absolutely available? Process measurement can help determine if United Health Department's functions are supporting the company overall. Process is referring to how well everything within the company is working, while on the current structure it's on. Are there enough patients who pay insurance premiums, especially during an economic crisis, that can sustain the company income? Are there records of medical tools set aside in case of shortage? Number of patients seen and number that can return for follow-ups. Does it change during a public health crisis such as COVID-19? Through these questions, you can see if the structure of the company supports the process. Outcome refers to the results of the process and the structure of the company. The results show how well the company is running and if it is prepared at all to prevent economic hardships on its staff and patients. Economic crisis can force patients to opt out of their insurance plans, and that means less revenue for United Health. Questions to consider could be the following. How many patients hold insurance premiums and continue to hold them during and after the pandemic? And the number of patients being seen, has it changed at all after the pandemic? With patient experience, this refers to the patient's expectations being met and fulfilled. To further investigate this, communication with healthcare providers and administrative personnel can help evaluate patient satisfaction. Is healthcare minimized or maximized in any way, especially during the pandemic? Was the level of patient care satisfactory? Were the chief complaints of patients being addressed and treated properly? Was there a concern from the patient regarding the medical professional's diagnosis or treatment pathway? How about health insurance options? Overall, if patients aren't satisfied, there's a need for improvement. In times during COVID-19, for example, accommodations should be made to lengthen patient satisfaction and reinforce patient flow, not shorten it or diminish it. Measuring the company's current operating performance can also be done with another tool known as benchmarking. Benchmarking is basically a scoreboard. The company can compare their structure, process, outcome, and patient experience measurements with other competing companies to learn from others and implement performance improvement opportunities as well. This tool can help set higher goals and advancements in the company improvements. Benchmarking can allow for the current performance improvement opportunities to be implemented and then built upon in the long run. Anything can change over time. Everything around the company changes over time. To keep up and succeed within the changes, the company must also strive for improvement continuously. Communication is also very important. Communication within the company can also help ease stress and concern about changes within the company. Communication amongst coworkers can help them come together and agree to improve the healthcare system one step at a time.
Company structure and processes can sometimes lead to resources, effort, time, and energy, which can ultimately lead to maximum value for its members. By using lean methodology, UnitedHealthCare can optimize its people and resources, effort, and energy to create maximum value for its members. Using lean methodology, costs and reduce overall negative economic situations, resources, and reduce the overall impact on profitability. Company structure and processes can sometimes lead to Lean Six Sigma uses a 5-step method to improve processes and solve problems. Step 1 is to define the phase, which means to define the problem. Step 2 means to measure phase, which means that you need to quantify the problem. Step 3 is analyze phase, which means to identify the cause of the problem. Step 4 is improve phase, which means to solve the root cause and verify improvement. And last, step number 5 is the control phase, which means to maintain the gains and pursue perfection in that improvement. As Patch Adams says, you treat a disease, you win, you lose. You treat a person, I guarantee you, you'll win no matter what the outcome. With that in mind, for a business that is in the business of people, keeping their patients happy is of the most keeping their patients happy is of the utmost priority. UnitedHealthCare can use patient surveys in order to have a heartbeat on how satisfied their members are. The services, data, the coverage that they provide. Improvement. Using that data, they can find opportunities for improvement. Implement change, and so they can use the Plan, Do, Study, Act cycle as a model to implement change. And by doing so, as Patch Adams says, you treat a disease, you win, you lose. You treat a person. The Plan, Do, Study, Act cycle consists of 4 steps. Step 1 is to plan. In this step, you investigate the current state of the problem to fully understand the nature of the problem that you are trying to solve. You have to develop a plan and a framework to work from and be clear on the desired outcome and results. Step 2 is do. In this step, you identify the real problem by analyzing the data and defining and implementing a plan for improvement. Step 3 is study. In this step, you compare current data to your baseline data. You have to determine if your change resulted in the expected outcome. You must also determine any lessons learned and summarize what you learned, including unexpected results, successes, and failures. And the last step is to act. In this step, you must implement your solutions and recommendations. You have to decide if the solution was effective and either integrate it into your work process or abandon it. If you abandon it, then you must restart the whole process again. Large volumes of data are collected in healthcare, but often little is available to staff or key stakeholders in a timescale or in a form that allows it to be useful for improvement. By creating a simple form of measurement, such as a benchmark, that data can become useful. These benchmarks can help understand progress over time and serve as a gauge that allows teams to understand which change ideas are beneficial and which ideas need further refinement to meet the intended outcomes.
Hello, my name is Mireya Lopez, and I will be covering Section 3, which is Conclusions and Challenges of the Performance Analysis. We'll start off by talking about the proposed implementations, which would be diversifying revenue streams and implementing preventative measures to reduce economic burden caused by medical costs. Diversifying revenue streams is beneficial. So, UnitedHealthCare Group is a nonprofit organization, which means a lot of its revenue is from government plans. The insurance coverages are primarily shifted toward government plans. If a nonprofit relies exclusively on grants, they might find themselves in a predicament of instability and uncertainty when priorities are shifted away from the organization, which means more revenue resources provide flexibility. By diversifying revenue streams, the nonprofit organization will be less vulnerable to financial uncertainty. That being said, diversifying revenue streams as a nonprofit is beneficial, but there are a few challenges when it comes to diversifying revenue streams, such as liability, higher risk of losing other revenue streams. Different revenue streams come with different risks, and uncertainty of private donations, and changing the mission. So administrative costs, we'll start with the cost of investment. Administrative costs requires employees of certain expertise, management systems, and managing over diversified portfolios demands more time, and it's harder to know what's happening in those certain assets or in those certain portfolios. Uncertainty of private donations. Long-term government contracts might scare away private donors because they may not believe that the organization is in need of any funding. And straying away from the mission to meet donor expectations, different revenue sources carry different expectations, and organizations sometimes compromise their image or mission in direction to the contributions or contracts. Excuse me. And that's it for diversifying revenue streams, and we will go on to preventative measures to reduce economic burden. Implementation of preventative measures would be beneficial long-term in reducing medical costs in case you are ever hospitalized or the patients are ever hospitalized and they have hospital stays that cost exponentially more than if you were to just go to an urgent care. But an attempt to implement these built-in services into medical insurances could potentially increase prices short-term by increasing deductibles and premiums. Paying up front or more a month for insurance as a just in case could drive patients away from opting into these preventative measures and plans, which would decrease long-term hospital bills due to natural disasters such as COVID-19. But these short-term costs might not be very attractive to a lot of these patients. And in conclusion, ultimately, revenue diversification strategies should create value for the core nonprofit organization, its private donors, and the government and communities it serves, and it should support their mission and vision. Diversification would increase the organization's autonomy, flexibility, and increase growth potential. The preventative measure aspect would benefit individuals long term, but potentially would look more burdensome cost-wise in the short term, as stated above. The COVID-19 pandemic affected the business of UnitedHealthCare Group Incorporated substantially, but the company was resilient and made changes in their benefits and coverage that would include anything related to COVID-19. The company's resilience was one of the primary reasons the company remained in good standing. Thank you for being here. Have a great day.